Hello and welcome. In this video, we will discuss how to conduct a teaching session in the OBGYN department. A clinical teaching session for a medical student or an intern should follow a structured format. This will ensure effective learning and skill development, and it will also ensure the development of the teacher. If you are asked to perform a task for teaching a junior, then remember, you have a limited time to perform this task. During the task, you will be evaluated on the following: communication with junior colleagues, your applied clinical knowledge, and patient safety. So the introduction and the pre-session preparation is important to have a good session. You can start by introducing yourself and also confirming the name and the level of the person that you are going to do the teaching session for. Create a good learning environment and establish rapport and discuss the goals and objectives of the session. Ask the learner about their level of knowledge, any previous experiences, and any specific learning needs or areas of interest. Now we move on to the main body of the teaching task. And in this particular task, we are going to talk about practical skills and procedures. So if you're going to inform a person or a junior about practical skills and procedures, then first you must inform them about the indication for performing the procedure, the contraindications, and the safety points to be discussed and considered during the procedure. So safety points are very important, and as an example, we can talk about forceps delivery. When conducting a forceps delivery in an obstetric patient, it is crucial to recognize that we have to keep in mind the safety of the mother as well as the safety of the baby. And this includes that the person who is performing the procedure should have proper training. So if you are teaching a junior colleague, then you must ensure that you pass the message that just on the basis of one teaching session, the junior person cannot perform the procedure on their own, and they will require supervision and they will require hand holding for some time before they can be considered to be and certified to be competent enough to do the procedure on their own. Other safety points include that you have to confirm that the indications are all present and positive. So you must make sure that it is indicated and that the procedure is appropriate for the situation. And of course, you must always ensure that the candidate or your junior knows that when they start doing these procedures, eventually they must have a senior colleague with them in all situations to make sure that they do not get stuck in a complex case. Obtaining consent from the mother again is a safety point, because she must ensure that the patient understands the implications and gives her consent willingly. Sterile technique is another safety point, must be followed to minimize the risk of infection. Fetal monitoring must be done, and you cannot do forceps if there is any serious fetal distress. The positioning of the mother is important as a safety procedure. Giving local anesthesia and communicating with the mother as well as the healthcare team. The technique must be gentle for the mother to have minimum tissue damage, and the tissues of the mothers must be protected and supported during the procedure. The baby must be given support as soon as the baby is born, and there should be neonatal resuscitation. And post-delivery evaluation is important to make sure that no damage has been done, which requires any specialized treatment. So these are some of the safety points. And another very important safety point is that the position of the baby in the pelvis should be appropriate. The level of the head or the station of the head should be appropriate, and the pelvis should be adequate enough for the baby to come through. So with all these points, you will find that in every procedure there are a lot of safety points that have to be kept in mind when you are doing the procedure. So make sure that along with informing the junior about the indication, the contraindication, the safety points are also mentioned as you go along. You then go to performing the steps of the procedure. And as you teach the candidate about the steps of the procedure, then you allow the student to perform the procedure under your supervision, providing guidance and feedback throughout the process. The proper technique must be emphasized, and it's important that the candidate or the person whom you are teaching should know about the importance of communication skills during the procedure with the staff which is around them as well as with the patient. So once the session has been completed and you have told them about the steps of the procedure, you've told them about the safety points, and you then go on to ask the candidate or your learner to summarize the key learning points from the session. You must also allow the student to reflect on their performance and identify areas for improvement. For example, the candidate may say that they did not understand one part of the steps of the procedure, and can we just go over it again? Provide constructive feedback. So perhaps the candidate has some difficulty in understanding the procedure or the conceptual basis for that procedure, and if that is the case, then you must give the feedback that this session would need to be repeated, and perhaps the candidate or the learner should go and read up about it, think about it, and then come back. At the end of the session, you must also express appreciation for the students' participation and effort, and you reiterate the goals and objectives of the session and how they align with the students' overall learning journey. You must allow students the opportunity to ask questions. And again, I repeat that you must create a positive learning atmosphere. So let's just go quickly over some points about what is the meaning of a positive learning atmosphere. It's important to be respectful and to encourage open communication and make the learner feel that they can ask questions and seek guidance. Must set clear expectations about the session that you are doing, as well as about the learning objectives, and also about what they can do after you have completed the session. You must encourage active participation of the learner and encourage them to ask questions and provide positive feedback, and also give some space for them to come afterwards and talk to you. It's important to create a culture of being kind and being supportive and inclusive. And as a role model, you can model all of these qualities to your junior colleagues. So now we'll just go through some procedures in gynecology, which can be a station for teaching. So for example, Verey's needle insertion for a laparoscopy, hysteroscope use, POPQ system, explanation, urodynamic charts or urodynamic graphs for explanation, how to insert a vaginal pessary, inserting an intrauterine contraceptive device, using manual vacuum aspirator, doing a Pipelle biopsy in a patient in whom there is an endometrial thickness, doing a pap smear, and conducting a feedback session. Some obstetric procedures can include the mechanism of labor, surgical management of PPH, breech delivery, fetal blood sampling, pudendal block, explaining labor room dashboard, episiotomy, shoulder dystocia, 1-2's delivery, forceps delivery, cesarean section in second stage of labor, management of third stage of labor, and management of uterine inversion. With this, we come to the end of our video. If you like the video, please press the like button and share with colleagues and with your juniors. Please write comments because we value your comments and we will reply to them. Kindly subscribe to the channel because your subscription is very important to allow continuation of this channel, and press the bell icon for notification of future videos. Thank you and goodbye.